A 4x6 card on both sides, but because this is your extra credit, you can't make all these pathways really little tiny and stick on there, okay? So words, but no pathways. I mean, if you want to put other pictures, that's fine, but you can't put the pathways on your cheat card, okay? Now, a word, I have done this a few times in the past, not every semester, every year, probably maybe 2 or 3 times in the last 10 years. And what I typically hear from students, in fact, I heard from a student this morning who's done this in other classes, after the exam, that really didn't help me that much. Not because the test is already written, okay? So it's not like I changed the test so that nothing you could write on the card is going to work. But that you spend a lot of time looking for it, or you learn the information making the card up or whatever. So if it helps you study, fine, okay? But think about it's the stuff that you might mix up, all right? Or get confused about or whatever. So think carefully about what you're going to put on there. And you don't want to just dump all your information onto that card. You still need to study. You still need to understand it. So while you're studying, you might want to mark, okay, this is something I get confused. This is something that I'm always mixing up or I can't remember or whatever. So it's not the lab exam you get the cheat sheet for, okay? But on the lecture exam next Thursday. And so think about that as you're putting the information on there. And don't write so tiny you can't see it. It's kind of like an open book test. This is not an open book test. But kids here, they have an open book test or an open quiz, and they spend all their time looking for information that they don't finish the test because they don't know it. It's just to look up things you're not sure about, okay? So this is for things that, it's more of a crutch. I don't like that word. It's more of a pillow. So you feel comfortable coming into the exam without some of the anxiety that then drives out the stuff that you really do know. Okay? So I need to check the card before you take the test to make sure it doesn't have the pathways on it. And that's just what I'm going to look for. You can write this information down, okay? I just don't want to see any diagrams of the pathways.
Is it front and back?
Front and back. Okay? I also put up another, not another, but I put up an announcement. Gretchen, we talked about this yesterday. Quiz 11 had a lot of fun questions about the mammillary body functions and amygdala and insula and stuff like that. But I'm not going to ask questions to that detail on the test. So I made that quiz extra credit up to the 10 points. And I went in and opened it up so you can see the answers. Okay? Normally you can see which ones you missed, but the correct answer isn't there yet because I want you looking that up. And this came from right and left field. So I went in this morning and converted it so your highest score would be extra points and changed it so you can go in and look at the answers. Okay? All right. So let's look at these pathways. And I've drawn it over here on the board. So on the slide over here, the brainstem has been highlighted, and the lines here are showing where these sections are taken from. All right? So down at this level is spinal cord. Cross-section of the spinal cord. This level is through the midbrain. This level is through the pons and cerebellum. And this level up here is through the, did I say midbrain? Medulla. Pons and cerebellum. This level is through the midbrain. Okay? And then this image right here is a coronal section through the brain. Again, those sandwich slices. Okay? So that's what we're looking at here. So spinal cord, medulla, pons and cerebellum together, midbrain, and then the coronal section. So what we're going to do is diagram the neuron. For a sensory pathway down here, it's showing the toe, the big toe, all right? And a sensory pathway coming into the spinal cord and traveling up the spinal cord through the brainstem structures, going through the thalamus out to the postcentral gyrus. So at the spinal cord level, remember we have the sensory neuron is going to be coming through the dorsal ramus or ventral ramus. Its cell body is going to be in the dorsal root ganglion, and then it's going to enter into the posterior gray horn. So all this should be review. And it will either synapse in the posterior gray horn or will move into the posterior white column, depending on what pathway we're talking about. All right, so here's the sensory ganglion, dorsal root ganglion, and posterior gray horn. Again, we've gone over the structures of the spinal cord, so this should be nothing new. These are, yeah, I actually have the D2L site open right now. Okay. Then the sensory fibers will move into the medulla. If they are posterior white column, they will synapse here. If they're spinal thalamic, they'll just continue to ascend. So over here on the board and on this side, these are the structures that you need to be able to recognize from the medulla, the medullary pyramids, and the nucleus gracilis and cuneatus, although I said I wouldn't require you to know which was which. All right? So gracilis and cuneatus. Then our sensory fibers move up through the pons. And so this is the diagram of the pons with the cerebellum shown here as well. The reason I have the cerebellum attached to the pons is, remember, we had our cerebellar peduncles. So we're going to be using our inferior cerebellar peduncles, middle cerebellar peduncles if it's a motor pathway. So I have the cerebellum attached to the posterior aspect. To save space, then the midbrain is overlaying that. And so here is the structure of the midbrain with the cerebral peduncles, substantia nigra. The red nucleus we'll use on Tuesday when we talk about motor pathways. And then when we look at the coronal section of the parietal lobe, we're going to be, for the sensory area, we'll be looking at thalamus. And here's the postcentral gyrus. All right? If it's motor, then it's cut through the frontal lobe, and we'll be talking about precentral gyrus, because that's where upper motor neurons are located. So those are kind of the structures as we go through. So the first pathway we're looking at here is the posterior column pathway, or the dorsal column pathway. It is for discriminative touch. In other words, when I pick up this object, I know what I'm holding. I can, even if I wasn't looking at it, I can tell you that it's a cap. I can't tell you what color the cap is because that's not part of discriminative touch. All right, but I can guess at how long it is. I can, tell you it's round, what it's made out of. I'm comparing that to other components and using discriminative touch. Proprioception, again, that's joint sense. Are my joints flexed or extended? And vibrational sense. Okay. So now let's take this diagram here is kind of putting it more three-dimensionally than I have on the board. So if that helps you, sometimes it's more confusing, but you're welcome to look at that view of it. So the posterior column pathway has these three neurons. So our first order neuron is coming from the skin for discriminative touch, or from a joint if it's proprioception. Okay? Let's say it's coming from my finger joints. I know that my tip of my finger is flexed. So that's going to come in through my ventral ramus, but if it was from my vertebral column and I was flexing my vertebral column, it would come in through my dorsal ramus. Its cell body is going to be forming the dorsal root ganglion. So if you were labeling this, this would be labeled as the first order neuron. Okay. This structure would be the ventral ramus. This structure would be the spinal nerve. dorsal root ganglion, where the cell body is located. And now this neuron, when we're doing the posterior column pathway, does the first order neuron tract or pathway, either one is fine. Does the neuron stop in the posterior gray horn? We're doing posterior column pathway?
No.
Nope, it goes into the posterior column. So it's gonna, does it cross over? Which of our neurons cross over? The second. So this one is not crossing. It's going to go into the posterior column. Wrong color. It's going to go into the posterior column, and it's going to ascend in the spinal cord in the posterior column, all the way up the spinal cord. Okay, if it's coming from my big toe, it's going to ascend the entire spinal cord in the posterior column because it hasn't crossed. And it's going to go up and into the nucleus cuneatus in the medulla. So you need to recognize that this is the medulla oblongata. And that these nuclei are nuclei cuneatus or gracilis. And that's where that first order neuron stops. Okay? It ends up here in the nucleus cuneatus gracilis. Yes?
How come it doesn't cross over in the spine?
I don't know.
Well, I mean, you said a certain one did and a certain one didn't. That's what I mean.
Second orders do. First orders never cross.
Oh. Okay.
We haven't gotten to our second order yet. I thought your question was, why doesn't it synapse with the second order neuron in the spinal column? I don't know. For this particular pathway, it goes up to the medulla to synapse. So the second order neuron, all right, is going to be in having its cell bodies are forming the nuclei. So that's the reason we have this collection of cell bodies. The reason we have a nucleus is because we have the cell bodies there. And so now we have the second order neuron. And its cell body forms the nucleus cuneatus or gracilis. Second order neuron, so guess what?
It crosses.
It crosses. All right? It actually crosses at a slight incline, so it doesn't cross horizontal. It kind of at a slight incline, so it might take a little bit of the medulla to do that. But it's going to cross over, and then it's going to ascend. And it ascends towards the posterior aspect, and it ascends, hold on just a second. It forms a ribbon of sensory fibers as it ascends. So I'm going to draw another one here just to kind of illustrate that ribbon. Okay, yes?
So it doesn't matter which side we start on. 'Cause
No.
like on that one, it's the left.
Both sides carry this information. Okay? So this is now the second order neuron. And notice it was the one that crossed. Here's the 1% of new information of a new structure. For this pathway, we call this tract, this part of our posterior, no longer posterior column, all right? So this part of the pathway is identified as the medial lemniscus. Remember lemma was like membrane? This is kind of like a ribbon. So the medial lemniscus is that pathway formed by the second order neurons as they go from medulla to pons through midbrain. So the midbrain, the pons, and medulla are all going to show a medial lemniscus. If you go back to the lecture on the brainstem on Tuesday, and I had the cross sections, you will see in the pons, in the midbrain, an area marked medial lemniscus. Okay, and those are the second order neurons. So it's like a subset of what we call the posterior column pathway. All second order neurons, except for the olfactory, end in the thalamus. And we have then the third order neuron. So the cell bodies of the third order neuron form the thalamus, and they will end up in the post-central gyrus on the opposite side of where this sensation was created, because we've already done our crossing over. Okay, so it's the third order neuron. And it's going to end in the post-central gyrus of the parietal lobe by synapsing with the neurons that are now going to process this. Because until it gets there, you're not going to have any detection of that. All right, so if there's a lesion in the post-central gyrus, even though all of these neurons are intact, you will have no vibrational sense, no discriminative touch from that region, okay, or from any of the regions if the post-central gyrus is, for those types of processing, is gone. And so this structure is the thalamus. Okay. So if I chose this for the extra credit pathway, these are the 3 neurons that I would want you to draw. And these are the structures that I would want you to label. Okay. So again, you can use that diagram on page 127 to practice diagramming it. Now, notice it's an ascending pathway. All ascending pathways are sensory.